Good morning to you. This is Dr. Beck here at LifePoint Medical, and I want to say good morning to you and let you know that we are doing great this morning, and we hope you are too. And we are prepared if you need us, so we can get you taken care of, or listen to what's going on and try to get you solve your problem solved if you have one. So give us a call if you do. Otherwise, just keep us in mind when you do have a problem. Okay, let's talk about COVID this morning. Actually, we've had a little bit of a jump, one case, but unfortunately there was an increase in the deaths related to COVID here. That hasn't increased in several weeks or even months, I believe, and but it ticked up to 42. But I'm not aware of what the situation is, and I think last time they did that, they moved it back down after they got something right. So we're okay. I think the community's still okay. Just keep your eye out on it and out for it, and keep doing the things we've been doing. All right. So I want to talk to you this morning about fungus. And the reason we're doing that is because this is something we're dealing with every day. Here is fungal infection. They do seem to increase when the warm weather comes in, and we have to treat them. And it usually presents as an itchy rash. And the rash will be usually in skin folds or areas of moisture, like under your breast or in your groin area. And like I said, there'll be usually a lacy red rash with irregular borders, with a little bit of increased intense redness around the borders, and that's how we can tell if it's yeast. There's a couple things about yeast that are kind of interesting. First of all, I had somebody mention to me, a young lady said something about, well, I keep clean. Why does this happen? And I'm like, well, it's not really related to you being clean. And actually, if you did a really, really good job cleaning, you may even promote fungal infection, because our bodies are constantly fighting a war between our immune system, the bacteria, and the fungus, and they all are trying to keep each other in balance. And if one gets messed with, like if we give you an antibiotic to decrease your bacterial, that actually gives the fungus a little bit of an advantage, and it'll come out. And we've seen that when people who take antibiotics and they end up with a yeast infection in their mouth or somewhere else. So it's a little bit weird. Really the way to prevent you from having a yeast infection is by keeping your skin dry and cool. And I recommend for people who have a problem with yeast in those moisture areas, they need to dry off really good after they get out of the shower. And they even might want to use a blow dryer to specifically dry certain areas that are prone to moisture, and that'll help some with the development of the yeast or fungus, which those are really the same thing. And then if that doesn't work, we'll be more than happy to see and talk about it. We have different treatment regimens that we use for it. Most of them are pretty safe and benign. Now usually will involve two different elements, or three, sometimes an oral medication like diflucan, or it might be a topical steroid, it might be a topical fungus, or sometimes I do all three, just try to get people under control and get them taken care of. So if you see this problem, you think you got this problem, we're more than happy to address it with you. And it doesn't mean you're dirty or really sick or anything. It's just something we have to deal with. Alrighty. That's my words of wisdom for the day. My other words of wisdom are, if you need us, give us a call. And remember, if you're interested in Place of Hope, I'd like to bring it up often. And you can ask me about what it is and what we do. And our mission statement is, we want to have an impact on the kids that enter the foster system in this community. And that's been our focus. That is our mission. That is our fellowship. That's what we're trying to do. So thank you in advance for all the support you've given us so far, or you will be giving us. So y'all have a great day. Please call us if you need us.